Everyone who is a fan of the angle remembers from the early days of COVID. Dr. B, I think you were probably on the show, I don't even know how many times, like 40 times during COVID, 50 times. But we were raising so many of these issues early on, and a lot of people scoffing at us. You got a lot of criticism at the time. But several senators asked about RFK Jr.'s stance on the COVID vaccine, whether it was safe and effective. Now President Trump is demanding data from Big Pharma on this. So what do parents, what do Americans need to understand now, given the seeming uncertainty about its efficacy?
Well, I think first, we're in a very different position than we were in 2020. When President Trump issued the order for Operation Warp Speed, it made a lot of sense, right? Because we had this new virus going around, and you had this possible new technology. It made sense to do a real study and try to develop the technology fast. In 2021, as we learn more about the vaccine, it didn't make sense to force people to get it. It didn't make sense to tell toddlers to get it. It didn't make sense to essentially mislead the American people about its ability to block infection. For kids, Bobby Kennedy is doing the right thing. Secretary Kennedy is doing the right thing. If you're high risk, maybe, but reserve the vaccine for people who might need it, who are older. But for everyone else, let's use a risk-based approach. Talk to your doctor, see if it works right for you. He's not blocking any access to the vaccine, as he said. What he's saying is, let's do what all the European countries are doing. They're not forcing 6-month-olds to take the vaccine. He's saying, let's do the sensible, science-based thing. Let's apply gold standard science. I absolutely applaud him for what he's done.
Wyoming Senator John Barrasso is a Republican, also a doctor. He actually sparred with RFK Jr. over the vaccine issue, telling them that he's growing deeply concerned. Watch.
Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership at the National Institute of Health questioning the use of mRNA vaccines.
He took a shot at your agency, Dr. Bhattacharya, the NIH led by you there. What's your response?
Well, a couple of things. One is that we are investing in other vaccine technologies that are quite promising for respiratory disease. If you want to block COVID, the mRNA vaccine doesn't block COVID. Right? So in a sense, it's a failed technology for that purpose. At the same time, we're also investing in the mRNA technology for other places where it's promising, for instance, in cancer treatment. And so you have like this sort of a nuanced response. What Secretary Kennedy did, actually, it wasn't anything to do with research using the mRNA vaccine or technology. He said, let's not order billions of dollars in production contracts for technology, for a vaccine that people aren't using. Only 20% or 30% of the American public has accepted the CDC's guidance that basically everyone 6 months old and up should have the COVID vaccine with booster after booster after booster, none of which has been tested against a randomized trial for the current strain, where you're checking against blocking hospitalizations or deaths. So you have a situation where it's just inaccurate. Like what Secretary Kennedy is doing is aligned with what the scientific evidence says, aligned with common sense, aligned with what President Trump's calling for, which is an honest evaluation, honesty with the American public. I think I'd love to talk with Senator Barrasso and tell him, like, look, we're not anti-science, which seems to be the tenor of the conversation. What we are instead is devoted to the scientific method, devoted to making sure that we spend the American people's money on science that advances their health.
Well, Bernie Sanders is also pressuring RFK Jr. on this same issue, and it got totally out of control. Watch.
Who are the organizations that are agreeing with you and casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz. There's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted?
Well, Bernie never let him finish his answer, but I think we've talked about the AMA, the ABA, a lot of these professional organizations for years on the angle. But is the AMA, in your view, Dr. Bhattacharya, co-opted by politics or big pharma?
I mean, they sure act that way. Let's focus on one organization, the American Academy of Pediatrics. First, they're funded by Pfizer and a whole bunch of these other drug companies. That's absolutely true. And look at their track record. During the pandemic, they recommended toddler masking, saying that there was no possibility of harm to any kids from. I mean, I got calls from hearing impaired moms saying, "Look, I can't really have my kid masked up because it's hurting their ability to communicate." They recommended the COVID vaccine for 6-month-olds on the basis of no randomized evidence that suggested that it protects against hospitalization or death for that group, which was very rare. They reversed their recommendation on school closures just because President Trump said we should open schools in the summer of 2020. They changed their mind and said we should close schools. I think we should look at science and not appeal to authority.
Dr. Bhattacharya, it's always great to have you on The Angle. Thank you very much.